Good evening and welcome to the COVID-19 update on Channels Television and Millicent Walker. First, the highlights. As highly transmissible Delta variant continues to spread, Ebonyi and Bayelsa states take measures to fight the pandemic. Ekiti State government laments disruptive effects of COVID-19 on farming. And Israel offers COVID-19 booster to persons under 60 and health workers. "753 more cases of COVID-19 were recorded last night, with 5 new fatalities. The Nigeria Center for Disease Control, NCDC, in its latest post, adds that the infections were reported in Lagos, the FCT, and 12 other states. The NCDC data show that 357 patients recovered from Thursday. So far, active cases are now nearing 12,000, with over 2.5 million samples tested. Let's take a look at Friday's update.
In the past 2 days, Nigeria has been reporting an average of 700 new cases owing to the spread of the Delta variant across the country. The latest figures coming from the Nigeria Center for Disease Control are 753 confirmed cases reported from 13 states and the FCT, indicating a drop by 37 from the figures reported earlier. Lagos topped the chart with 364 cases, followed by Akwa Ibom with 141 infections. Oyo had 74, Rivers registered 46, Abia 38, Ogun 24, while Kwara reported 20 cases. 12 cases were registered in the FCT, 10 were reported in Ekiti, Delta had 9, Edo 6, Plateau 5, 3 cases were reported in Imo, while Bayelsa registered 1 case. There were 0 cases reported from Kaduna, Kano, Nasarawa, Ondo, Osun, and Sokoto. Nigeria now has a total of 180,661 confirmed cases. There have been 357 discharges in the last 24 hours, increasing the total number of recoveries to 166,560. The NCDC also reported 5 additional deaths from COVID-19 causes in the last 24 hours, raising the fatality toll to 2,200. Presently, there are almost 12,000 active cases in Nigeria, while over 2.5 million samples have been tested. In Africa, there are over 7.1 million confirmed cases, and more than 181,000 deaths have been recorded across countries on the continent. The total global confirmed cases have now surpassed 205 million, while more than 4.3 million deaths have been reported.
The head of the Public Health Department at the Ministry of Health in Bayelsa State, Dr. Yerin, has disclosed that the number of persons testing positive for the virus is on the rise, especially as the transmissible Delta variant surges. Meanwhile, in Ebonyi State, the government says it will continue to take steps to curtail the spread of the virus, insisting on strict adherence to the non-pharmaceutical protocols.
The spread of the Delta variant detected in the country has resulted in a spike in cases and fatalities from COVID-19. In spite of this disturbing development, non-compliance to safety protocols is still a concern across parts in the country. In Bayelsa State, most residents are seen mingling freely in disregard for all precautionary measures.
I want to say that, yes, most of us are guilty, especially in this part of the country. We are not even adhering to the COVID-19 guidelines and principles. We take it very easy. Disease not a kill African man. But as far as I'm concerned, whether we like it or not, disease they kill African man. That is why we are also dying.
The head of the Public Health Department explains that the Delta variant of the virus has not been recorded in the state.
We have been part of all of the process from the Federal Ministry and the Nigeria Center for Disease Control. We've also through with all of the measures to ensure we can prevent and curtail and manage the spread of the coronavirus.
The disregard to safety protocols is also prevalent in Ebonyi State. The Commissioner for Health in the state says the new strain of virus has not been detected here.
So far, so good in Ebonyi State. We don't have any case of COVID at present in our isolation centers or home isolation treatment. But we don't have any case.
The Nigerian Center for Disease Control is encouraging everyone not to let their guards down in the face of the new Delta variant to avoid too many casualties.
And to the southwest, where a consultant at the neuropsychiatric hospital, Aro Abeokuta, has identified belief value system, wrong perception and inability to sustain lifestyle modification in the face of the pandemic as some of the reasons for non-adherence to safety protocols among residents of the state. He says culture and religious sensitive awareness among residents can promote healthy living. This period, Ogun State, which has recorded over 5,000 cases and 62 deaths.
If large gatherings are a channel in the spread of the coronavirus, adherence to NCDC precautionary measures remain important for its curtailment. However, in most parts of the country, compliance remains a huge concern. Residents in Ogun State appeared unbothered as they go about their businesses with no adherence to prescribed safety protocols. A consultant psychiatrist highlights some factors that may be responsible for people's attitude in relation to non-compliance.
A lot of us, we are used to socialize. Some of these things that are main protocols for COVID-19, they are not ingrained in our culture. People are used to their freedom, they are used to social activities. As a matter of fact, the period that there was lockdown and people were not allowed to move around, we as mental health experts, we notice all such, even in the prevalence of mental illnesses.
The mental health practitioner is recommending more awareness for NCDC safety protocols.
We need to use what is culturally acceptable, what is religiously acceptable, ethnically acceptable, the role of violence, the harbors. As a matter of fact, when the religious leaders are having their shot, it should be televised live so that they know that, oh, this person that I'm trying to pattern my life after, this person that has influence over me, when this man says, don't do this, it tends to sink more than when it is just coming from experts or just from medical practitioners.
The pandemic has continued to threaten lives and livelihood as Nigerians are expected to sustain their collective responsibility in containing the spread of the disease.
There is heightened surveillance and firm measures in place to curb the spread of the coronavirus disease across all NYSC camps in the country. The Minister for Youth and Sports, Mr. Sunday Dare, explains that there are concerted efforts to ensure constant testing in the camps. The Minister was speaking on the occasion of the International Youth Day when he featured on our Politics Today program.
We see a commendation from the NCDC because of the regime of surveillance that has been put in place across the NYSC camps. It's almost a rule of the thumb. Once anybody tests positive for COVID-19, you are not even allowed into the camp. You are turned up immediately, isolated. And if along the line there's constant testing, they find anyone with COVID-19, that person is isolated. I think the NYSC camps are no different from the society in which we also live in. But also, they have more stringent measures in these NYSC camps. And I think some of the data that is collected there have been so useful to the work of the NCDC. So on a continuous basis, as even the larger society battles with the containment of COVID-19 through non-pharmaceutical processes, we have the NYSC running a regime that is effective and has worked so well in the last 6 months.
Well, joining us right now in the studio is the Head of Risk Communication with the Nigeria Center for Disease Control, Dr. Yaya Disu. Thank you for joining us. I can see you physically in the studio. Thanks again. So let's start with what we heard from the Minister of Youth and Sports, surveillance at the NYSC camps. What happens? And this is because it appears we've not had a major outbreak in such a camp in this situation.
Yes, what happens is, luckily for us as a country, NYSC has been platform where we have used to validate our rapid diagnostic test kits, and that is when core members arrive in camp, and then they are screened with these test kits.
Okay.
And that way you're able to know their status before allowing them to go into camp. So everybody coming into camp, whether a core member or whether you are an official or a visitor, even we NCDC officials, when we visit those camps, we are all tested. So before you go into the camp, even the vendors, everybody is tested. The military men, everyone, even the camp officials, starting from the state coordinator, NYC coordinator, they are all tested. And that is the standard. And then they also ensure that they comply with the protocols and hygiene, use of face masks, physical distancing. You know, you've done orientation camp before. You know how...
So how regular is there like a follow-up test with the RDTs within the 3 weeks as well, or just when they're going in to the camp?
The ideal thing is when you go in, because they are going to spend about 2 or 3 weeks in camp. So when you are coming in, there are people who take information from you to know whether you are high risk and risk of exposure. So all those things are things they will put together to know whether you will need another testing. For instance, if you say you just stop taking care of a close relative who had COVID-19, so that means your own case is a special case. But generally, they screen people and they ask questions and they put all those information down. So, but more importantly is the protocols they comply with in the camp.
I want to talk about the COVID-19 situation report. That's from the NCDC report 43. I mean, it's showing quite a list of things. One, the increase in the number of cases, also the increase in the number of discharge cases as well. But we've also seen 38 deaths. The country recorded 38 deaths in just a week. But I'd like you to speak to inbound international travelers, because from what we're seeing, almost 5,000 inbound international travelers, out of all of them tested, 157 were positive. And then when it comes to the outbound travelers, about 268 also tested positive. The question is, I know tests are conducted before taking a trip in or out. So at what point do they, test positive to the virus?
Now, because getting the virus, you need to be exposed first. So when you take a test now, it now depends on the activities. Even if you are negative today, the activities you are involved in after the test will expose you. So those who come into the country, 72 hours before they come into the country, they take the test and they must be negative. But that does not mean they may not even be incubating the virus at that time. Because if they are incubating at the time they are doing the test, they are just exposed, there is no way you can detect the virus. But a few days down the line, then you can pick the virus. So that is what happened. That's why Nigeria imposed the second test, that is 7 days after arrival in the country. And they warned the travelers when they arrived that they should self-isolate because the risk of harboring the virus will still be there. And then, so they wouldn't have spread it around. So they stay at home for those 7 days and they don't receive visitors. If they have to do that, maybe through phones and through other means to minimize eye contact with people. And then it is after the second test, when you are negative, then we are sure that you're not bringing in any variant or anything into the country. Then you are free to move around. That time, we are sure that you are free of the virus.
And this is the same thing that applies to those leaving the country?
Those who are leaving the country, it depends on the country you are going to. Different countries have different protocols. So some will tell you, you may not even need to do tests before you come into their country. And the airline, they make sure that they comply with those protocols. So it depends on the country that you are going. But generally, too, most countries now are now screening people who come into their country.
All right, we'd like to appreciate your time. Thank you so much for joining us on the program. Head of Risk Communication with the NCDC, Dr. Yaya Disu. Thanks again. Still to come on the program, global data trends are showing that the pandemic isn't over. We'll bring you updates from around the globe. Please stay with us. In Ekiti State, the government says it's regrettable that COVID-19 has been disrupting farming activities and bringing limitations to the vulnerable. The governor, who was represented by his deputy at an International Youth Day forum organized in the state capital, says it is important that youths are empowered to be active in governance and nation building. He says for the state government, integrated approaches and inclusive framework must be adopted to enhance agricultural solutions.
Today, COVID-19 is adding to the strains on our food systems, disrupting markets and supply chains for small-scale farmers, not only in Nigeria, even around the world. Threatening peace and stability, particularly among the most vulnerable and marginalized populace. Therefore, a more holistic and inclusive framework is needed to address these complex issues through integrated approaches.
Now, some countries are reporting more new coronavirus infections compared with the previous 2 weeks. Germany says it will start providing free COVID tests to unvaccinated residents beginning in October. It's the latest move to encourage vaccination as case numbers rise with the spread of the highly contagious Delta variant. Deutsche Welle correspondent Stephen Biazzi joins us now from Berlin to talk about the latest government action on the growing cases. Hello, Stephen. What's been the reaction to this decision by the government?
Yeah, mostly there's been support to this decision, and that's what we've seen across the board. Now, of course, there are critics who warn that this is a backdoor entry to a vaccination requirement, but many disagree, saying that this is understandable, including the Ethics Council in Germany. They've looked at this and said that this is a reasonable decision when you take in mind who choose not to be vaccinated are choosing not to protect themselves, they're choosing not to protect the community around them, and that means that they should not expect that their test costs should be covered. So what will these be? It looks like they'll be around 10 euros per pop. That isn't cheap when you think about how much you might need these tests for in the future. So there is a bit of an expense there. Again, the hope is to really give a gentle nudge to the population here to get vaccinated. Vaccination rates have fallen off a little bit here, as one would expect after the first surge. There is this push, especially as colder temperatures are in the horizon. As the end of summer is coming, we see that the Delta variant is already spreading quickly here. There is this push to really try and get those vaccination rates up.
Is there an expectation that Germany, like France, could require vaccinations for parts of public life?
Yeah, that is the question. That is really the burning question, I would say, right now in Germany, whether there will be a vaccine mandate. Right now, what is required, what is going to be required is that anyone who is tested, vaccinated, or recovered can have entry into inside areas, that is clubs, restaurants, cafes, any sort of inside event that is still going on right now. There are some politicians who are already raising the idea of, what if we removed tested from that list? That means you have to be vaccinated or you have to be recovered to gain entry. In other words, a vaccine mandate. One of Germany's most prominent politicians, Markus Söder, he's head of the Bavarian Christian Social Union. That's a sister party for Merkel's CDU. It's a very important party here. He's already raising that and saying, why don't we go ahead and tackle this issue now? We know that more private entities are going to start raising that themselves. They're going to start requiring these things. And when we look over at France, we see that there is already a vaccine requirement there. There is a vaccine pass required to get into cafes for train travel, for example, airplane travel. So why don't we go ahead and bite the bullet and start to discuss it now? There is a problem with this, though. There are several problems. One is that it's unclear if it's legal in the first place. Second, the Ethics Council, the same one that said that it's okay to require payment for the test, has said requiring vaccination is dubious. It hasn't said much more so far, but it's warned that this could be a step too far. And then probably the biggest hurdle right now is that the federal elections are coming up at the end of September. That will decide Merkel's successor. And none of the candidates really want to touch what could be a divisive issue, what is certain to be a divisive issue before those elections take place. So we're most likely going to see this question not resolved until later, perhaps after these elections.
So a mix of public health measures and politics, but Europe is heavily dependent on tourism. What does travel across the continent look like right now, especially as the Delta variant continues to spread?
Yeah, August is typically one of the biggest months for tourism here in Europe. This summer has been a summer of some travel, but definitely not normal travel. Now, we've seen that since July 1st, travel here in the EU has been open to a lot of countries that normally provide those biggest travelers, the US, Australia, for example. But these are countries that in the meantime are also now starting to have their own problems with the spread of the Delta variant. They haven't been barred from entry so far, but one could imagine that changing in the weeks ahead. So already some things are starting to happen. And now within Europe itself, inter-European travel is always very important for these countries as well. But that has also been limited as the variant has spread. Now, TUI is one of the biggest travel bookers in the world, and most of its business is here in Europe. It said that its business this summer so far has been 68% of that it was in 2019. I'm sorry, down 68%, I should say, to clarify, down 68% from 2019. Now, that's massive. And you can see that a great portion of that comes from the UK. There have been travel restrictions there. That means that those bookings have fallen off. But also lately, or more recently, as you see, some of these typical travel destinations, think Italy, Greece, Spain, as they've started to see more of the Delta variant, travel has fallen off there. So some of these tourist destinations that people normally go to are starting to become more off limits. Reason for optimism, bookings have picked up in Germany, where the rates have been a little bit slower to climb, and also in the UK, as travel restrictions are starting to slowly fall away, we're starting to see more bookings rise there. So the industry is hopeful, but it hasn't been quite the summer that normally you would obviously hope for.
All right, many thanks, Stephen Bialski, there, Deutsche Welle correspondent. Thanks for that update. And as the world continues the battle against COVID-19, over 204 million cases have been recorded, with the death toll exceeding 4.32 million. Over 4.4 billion vaccine doses have also been administered across the world. Let's take a look at the latest developments.
Israel has lowered to 50 from 60 the minimum age of eligibility for a COVID-19 vaccine booster shot, and will also offer them to health workers hoping to stem a surge in Delta variant infections. After a successful vaccination campaign launched in late 2020, in which around 60% of the population have received 2 shots of the Pfizer vaccine, new daily cases dropped from more than 10,000 in January to single digits in June. Over the spread of the Delta variant across the globe, new infections have jumped in Israel, reaching 5,946 on Monday, and serious illnesses have been increasing as well. According to China's National Health Commission, more than 777 million Chinese have been fully vaccinated against COVID-19, accounting for 55% of the country's 1.4 billion people. The country is experiencing a resurgence of locally transmitted cases driven by the Delta variant, and health authorities have been working hard to contain the epidemic. Over in the Philippines, hundreds of motorcycle and delivery riders queued at a vaccination site in Manila today amid a growing number of coronavirus cases in the Philippine capital. Drive-in vaccinations for motorists were initiated to help protect the transportation sector amid a rise in coronavirus cases worsened by the Delta variant that has prompted a 2-week lockdown in the greater Manila area. New South Wales State has reported 390 new locally acquired COVID-19 cases, the highest number since the start of the pandemic. It comes despite a nearly 7-week lockdown in the state capital, Sydney, and eclipsed the daily high of 356 set on Tuesday. Daily cases have topped 300 for the past 4 days.
We had, unfortunately, 390 cases of community transmission. Some are still under investigation, but at least 60 of those have been infectious in the community. And I anticipate, given the large number of cases we've had in the last few days, that unfortunately this trend will continue for at least the next few days. So it means all of us have to work harder to make sure we stay at home and follow the rules.
Meanwhile, Australia's capital city, Canberra, has entered the first day of lockdown in more than a year after the territory recorded 2 new cases. Investigations are still underway to find the source of the outbreak in the territory, which has largely escaped any COVID-19 cases since the start of the pandemic. And finally, Russia has reported a record high 815 coronavirus-related deaths in the last 24 hours, while Moscow's mayor says hospitalizations from the disease in the capital have halved over the past 6 weeks. Russia's daily reported COVID-19 infections have gradually dipped from a peak in July that authorities blamed on the infectious Delta variant and a slow vaccination rate.
Let's all continue to take responsibility. You can see our website for more updates, also a better understanding of the pandemic. You can find some other breaking stories as well. It's channelstv.com. It's at your fingertips. That's the program for the week. Thank you for watching. I'm Melissa Ntumwaka. Stay healthy.